Welcome back to Health Insurance Unraveled. As always, I'm your host, Travis Dahlman. I'm a licensed health insurance broker. Today, we're going to do a high level overview of what is a deductible and how that may affect you in your insurance, whether that be Medicare, Marketplace, as a dependent under somebody's group policy through an employer, or if you have employer coverage yourself. Most every single policy out there has a deductible affiliated with it. Sometimes that deductible is $0. Sometimes that deductible is $100, $200, $1,000. Does not matter what your deductible is. It's going to be the same exact terminology, regardless of the amount your deductible is. As well as we're going to dive into what's the difference between a prescription deductible for those individuals who are on Medicare versus a medical deductible and how those differentiate from each other. As always, any questions you have, contact information is below on the screen. Otherwise, feel free to throw a comment in the comment section. So let's begin. What is a deductible? In high-level terms, a deductible is the amount that you are responsible for paying before the insurance pays their portion. What does that mean? What that means for you is, I get this question quite a bit. Is that a co-payment? Is it a co-insurance? I had to go see my doctor. I paid $5 when I saw my primary, $45 when I went and saw my specialist. That typically isn't a deductible. That is your co-payment or your co-insurance. A deductible is the amount that you're responsible for paying before the insurance pays their portion once again. So if you see any type of co-pay or co-insurance on a billing summary, that is not a deductible. That may go towards a deductible, perhaps, depending upon the type of policy you have. However, that is not a deductible. A deductible is the amount that you are responsible for paying specifically. For an example, under Marketplace policies, you may have a $1,000 deductible. So when you go to pick up medications, this is specific for Marketplace policies. If you go to pick up medications, if you go to a facility to see your doctor, have an operation, anything like that, everything that you pay for out of pocket will go towards that hypothetical $1,000 deductible. Once you meet that $1,000 deductible, then the insurance starts paying their portion for covered procedures, covered medications, based upon the policy you have for Marketplace. Once again, we're covering just Marketplace right now. Hypothetically, the situation, let's say you need to have a knee surgery. Your deductible is $1,000. After you meet your deductible, your policy says that you have a 10% co-insurance. So you have a $20,000 knee surgery, you receive your statement in the mail, first procedure you had all year. You're going to see, okay, yep, you're responsible for the first $1,000. That's the deductible. After that $1,000 is met, then you pay your 10% co-insurance on the remainder of that bill. Under this particular scenario for Marketplace. So after you meet that deductible, you don't need to meet it again for the rest of that calendar year. So let's say you have a left knee surgery, cost $20,000, paid that $1,000 deductible, 10% co-insurance after that. Second knee surgery you go in later that year, the left knee, now we're in there for your right knee. Instead of paying that $1,000 deductible again, because you already met it, you just pay that 10% co-insurance on that $20,000 bill. Basically, once again, deductible amount you're responsible for paying before the insurance starts paying their portion. You only have to meet it once per year. When it comes to Marketplace policies, it combines your prescription along with medical together. Employer coverage, dependent upon the employer policy you have. Your employer policy may group the medical deductible together with the prescription deductible. So contact your HR representative, contact your insurance carrier, reach out to myself, whoever you trust. If you're on a group policy and you want to know whether or not you have two separate deductibles, you can also, like I said, typically check your medical records as well, and they should have that in there if you have any billing summaries. As far as Medicare goes, Medicare is a little bit different. Medicare has typically two different deductibles. They have the medical deductible as well as the prescription deductible. What's the difference between the two? The difference is prescription Part D, prescription drug. You go to the pharmacy, you pick up a medication at the pharmacy, that's going to be covered under Part D. Anything else that happens to you in a facility, if you get a cortisone shot in your knee, if you have any surgeries, IVs, basically anything that happens to you inside of a facility, that's going to fall under the medical deductible. So medical deductible is done in a facility, prescription drug deductible at a pharmacy when you pick up a medication. Why that's very important to you is a lot of policies out there. Let's say you have a Medicare Advantage type of policy under Medicare. Medicare Advantage plans typically have a $0 medical deductible, which means that the insurance starts paying their portion right away, and you just pay either your co-payment or your co-insurance, depending upon how your Advantage policy is set up. So hypothetically, in this situation, let's say you have a $0 medical deductible under your Medicare Advantage policy. You go in for that same knee surgery that the marketplace beneficiary went in for. $20,000 knee surgery, outpatient, typically get you in out same day for knee surgeries now. $20,000 cost for that procedure. You go in, $0 medical deductible, you just pay your outpatient hospitalization copay. So let's say in this hypothetical situation, $385. $385 is your copay. Worst case scenario for outpatient procedure. You go in, have the procedure, leave, you get your bill in the mail. 3 months later, 3 weeks later, whatever that billing department sends it out, shows $20,000 bill. Insurance paid this portion. Your responsibility would be that $385 in this hypothetical. Once again, the insurance started paying their portion right away because your policy had a $0 medical deductible. Now, not every single Advantage policy has that $0 deductible. Let's give you a scenario where your policy has a $1,000 medical deductible. Same as the marketplace, $20,000 surgery. You go on first time for the year. You're going to be responsible for that first $1,000, meet that medical deductible. After that medical deductible, you pay that $385 outpatient hospitalization copay. So then that leaves you for the rest of the year basically free and clear of that medical deductible. You go in for your other knee surgery later that year. First knee surgery, you had to pay $1,000 plus the $385, so you were looking at $1,385 in that scenario out of the $20,000 bill. Second knee surgery, that same calendar year, you're looking at a $385 copay because you already met that deductible earlier in the year for the other knee surgery. Once again, you only need to meet that deductible once per calendar year for a specific policy. Now, on to the prescription drug portion. Medicare recipients, once again, 2 different deductibles. Medical, we just covered. Prescription, we're going to cover next. For prescription deductibles, every policy is a little bit different. Medicare sets the standard, basically says, hey, this is the most you can charge for a prescription deductible for the calendar year. Every year, it's a little bit different. You want to know what the max is for 2024, reach out to your representative, reach out to myself, come October, and we can let you know what it's going to be for next year for 2024, what the max is going to be. As far as for prescriptions go, some prescription policies have a $0 prescription deductible, which means that you go in, you pick up your medications at your local pharmacy, and you either pay a $0 copay, 5, 10, 15, 20, 40, 80, 100, whatever your copayment or co-insurance is. Insurance starts paying their portion right away. There are some policies out there that have a $0 prescription deductible for tier 1 and tier 2 generic medications. But then once you start getting into brand name medications, tier 3, 4, some specialty tier 5 medications, you may have to meet like a $400 or $350 prescription deductible. What that means is first time you go pick up a medication, you're going to pay the actual cost of that medication up until you hit that deductible. At which point, when you hit that deductible, at that point, then the insurance will cover the cost accordingly. So in this particular example here, let's say you take a tier 3 medication that costs $500. Medication costs $500. You have a deductible of $300. After you meet that deductible, you have a copay of $40 for tier 3 medications. So once again, $500 medication, this example, $300 deductible. Cost of the medication after the deductible is $40. First time you go to pick up that medication, you're going to pay $340 for that medication. How do you get there? $300 deductible plus $40 medication, plus $40 copay after you meet that deductible, and then the insurance will cover the rest of that cost of that $500 medication. The next time that you go to pick up that medication or for the remainder of that calendar year, as long as you don't hit the coverage gap or the donut hole, and if you want more information on that, we'll be covering that in a later series here. As long as you don't hit the coverage gap or donut hole, you're going to just pay that $40 copay for the rest of the year for that particular medication. Even though that medication costs $500, the insurance is going to cover $460. You're going to pay that $40 copay. So the insurance company starts paying their portion after you meet the deductible once again. So medical deductible, facilities, prescription deductible, pharmacies. That's the major difference between Medicare deductibles and marketplace deductibles. If you have any questions on this information, if you would like more a deep dive or have specific questions about your policy, if you're wondering about your deductibles, if you have to meet them, if you have a deductible at all under your policy, reach out, contact information below. Myself, I can answer pretty much any question, get you pointed in the right direction. As always, feel free to reach out to your customer service team if you have any questions on your deductible. As always, my name is Travis Stallman. This has been Health Insurance Unraveled. Thank you for watching.